Hi, my name is Carly Kelly, and I'm going to be talking about improving telehome care by addressing existing problems and concerns. Although the research on telehome care has shown many positive effects on overall health and finances, there are some negative effects of this form of health care that should be considered when deciding whether or not it would be a good fit for a particular patient. It is evident that there are many barriers to implementing successful telehealth programs throughout the U.S. However, many organizations, corporate businesses, and even government entities are working toward solutions to the problem at hand. Some of these solutions seem to come with their own list of barriers, so based on the research about these proposed solutions, I have come up with some solutions of my own that I believe could help to move along the implementation of telehealth services nationwide with fewer barriers. Most of the patients that would benefit from telehome care are elderly. Coincidentally, elderly patients are at higher risk for improper management of their medications when compared to younger patients. While a benefit of telehome care can be empowering patients to take control of their own health management, this can backfire with elderly patients who have a hard time remembering to take medications at the proper times. The majority of older home healthcare patients take 5 or more different medications daily. Even for an average person, the instructions of chronic illness medication regimens can be difficult to manage. For this reason, research is being conducted to find ways for telehealth care to improve in order to ensure patients are able to more independently administer medications properly to optimize disease and illness management. One company that is working towards solving this problem is a company by the name of MedMinder. MedMinder has developed an electronic medication dispenser with a built-in reminder to remind patients to take pills at the appropriate times. A concern with MedMinder's product would be if a patient is not around the pill dispenser when the reminder goes off for the medication to be taken on time. In a case such as this, the reminder would go unheard and the patient would still miss a dose of their medication. Additionally, a company by the name of AdhereTech has developed a program that includes smart pill bottles for each prescription that a patient has that will send a text message or call the patient's cell phone if a dose of a particular medication was missed. The pill bottle comes in the mail and does not require setup because it is individualized to a patient's medication needs. Much like MedMinder's potential flaw, if the patient's phone is dead or the volume is not turned up when the reminder for medication sounds, the reminder would not reach the patient when it needs to. It is apparent that companies around the country are realizing the growing concern of elderly patients missing medication doses throughout their day. The proposed solutions include technology that requires elderly users to remember to charge electronic devices or be near their devices throughout the day. Because of the technology for solar-powered waterproof watches is available and used outside of healthcare, I propose the use of this technology for medication reminders on a wearable device that can go anywhere. A solar-powered wristwatch or necklace pendant that rings and or vibrates when medication doses are missed can help an elderly patient to remember to take their medications without requiring them to change the device or keep it close at all times. Other concerns with telehealth care is reduced care continuity. While some on-demand services provide immediate response for healthcare professionals to patients regarding health concerns, these services may also make care for the patient's primary physician more difficult. The problem with this type of care is that the provider does not have the personal insight to their patient's condition that they would if they would be caring for the patient in a traditional setting. Because doctors and nurses from anywhere can respond to a patient's questions or concerns, there may not be accurate or up-to-date patient records. The lack of a common health information exchange system among all healthcare providers further exacerbates the reduced care continuity. Because each healthcare provider that interacts with a patient is unable to submit their notes and recommendations to a common database of patient records, other healthcare providers that treat said patient may be repeating the work of others or be steering in the wrong direction entirely. This in turn can result in decreased quality of care. In order to optimize care continuity within telehealth care's on-demand patient care services, a nationwide information exchange must be adopted by all healthcare facilities in the U.S. In 2010, the Office of the National Coordinator of Health Information Technology announced the State Health Information Exchange Cooperative Agreement Program awardees. This program funded individual states to create their own information exchanges, including grants ranging from $1 million to $39 million. Some of the state information exchange systems included information exchange across state lines, but much of the state programs only encompassed healthcare facilities within the state. A push toward a universal health information exchange system has since been underway to provide a nationwide database for electronic medical records that could be accessed by all health professionals as needed. GE Healthcare has presented a health information exchange that is designed to encompass all types of healthcare facilities, so each practitioner that a patient sees can contribute to the patient's health record. Healthcare professionals can also access the information about the patient and that other practitioners have entered in order to make more informed decisions about how to continue their plan of care for the patient. I believe that a government entity rather than a third-party organization such as GE Healthcare should develop a universal exchange system that can be highly safeguarded. After the information system is developed and properly safeguarded using a HIPAA security checklist, the system, rather than money, can be distributed to healthcare facilities around the country. This prevents healthcare facilities from simply using the government grants to purchase third-party health information exchange systems they choose, which may or may not be capable with those across state lines. One of the largest barriers to preventing health information exchange systems from coming to fruition is the concern that arises in privacy and security of patient electronic health records. According to Honora Fernando, principal engineer at UL, when network-dependent technology that uses Wi-Fi connection to gather and transmit health data is deployed, there is always a concern for confidentiality of personal health information. There is a growing privacy and security concern that comes with the introduction of healthcare information exchange. As of now, when companies tell consumers that their personal information will be safeguarded, the Federal Trade Commission acts to ensure that they are living up to their word. This includes companies that design and distribute hardware and software for telehealth services. If these companies violate privacy laws and mislead consumers by failing to maintain security of privacy patient information, they can and will likely be charged with violation of Section 5 of the FTC Act. However, there is no federal agency that has the authority to enact privacy and security requirements to cover the telehealth ecosystem. Perhaps giving a government entity this power will allow for a more comprehensive plan for protecting the security of patient information as technology progresses. I recommend that either the FTC or the U.S. Department of Health and Human Services is given this responsibility, since they are the government agencies that are currently working towards enforcing existing privacy and security rules for patients and consumers, and the U.S. Department of Health and Human Services or the FTC can create constantly evolving frameworks regarding the safety and security of patients and their confidential health records in order to increase trust among patients and care providers. As technology and telehealth care advances, it is important that legislation and regulations surrounding the newest healthcare services advance to ensure continued protection. This is why I believe the responsibility of developing a comprehensive, flexible framework for privacy and security in telehealth care should fall on government agencies instead. If these agencies carry the responsibility of developing the specific framework for secure telehealth care, as technology develops, security can be maintained by ever-changing regulations decided upon by the FTC or the Department of Health and Human Services to make sure all security bases remain covered. One of the biggest legal issues with implementation of telehome care services is the dispute over patient jurisdiction. A study published by the U.S. National Library of Medicine found many controversies involving competing claims of patient jurisdiction between many healthcare organizations around the country. Concerns about proper reimbursement for healthcare services have also become obstacles with the use of telehealth care. State-to-state laws differ when it comes to care requirements for full reimbursement, making it difficult for practitioners and patients to give and receive telehealth services across state lines while ensuring proper reimbursement for services will be provided. As technology in healthcare has come a long way in recent years, so have healthcare laws, reimbursement policies, and private protection rules for healthcare providers. In some states, such as California, reimbursement of telehealth care is still very limited and specific. In other states, such as Kentucky, however, Newly adopted legislation is being developed to encompass nearly the same amount of reimbursement coverage for telehealth care services as there would be for in-person care. Patient jurisdiction laws and reimbursement policies are determined by state governments and insurance providers. For this reason, it is important for healthcare providers and their supporters and other telehealth care supporters to advocate for updated legislation that works in their favor. For example, interested elderly, disabled, rural residents, and others alike who would benefit from telehealth care services expanding should advocate for new legislation in their state that would allow for more accessible remote care with minimal jurisdiction restrictions and maximum insurance coverage. I also believe that telehealth providers can create applications and team up with private insurance providers to develop reimbursement guidelines for the application's services. This way, specific healthcare providers who aid patients through said telehome care apps can receive proper compensation for their services. This insurance coverage would lead to an increase in a patient's likelihood to seek out telehealth services and improve their primary health management. So, although telehealth care services prove to be problematic in their implementation phase, hopefully a combination of the solutions discussed can help this form of healthcare to become more universally accepted and utilized for the greater good of the public.